So your shoulder is hurting, you don't remember anything happening, there was no trauma, there was no incident, you're feeling quite overwhelmed, you're feeling quite stressed, you work hard enough as it is, and now your shoulder is giving you bother. You watched the first video that I made and I explained to you why and what this type of shoulder pain is, and now you're here because you want to know what does the scientific evidence recommend to treat this type of injury. Hi everyone, welcome back to the channel. My name is Paul. This is the second video in a two-part series on non-specific shoulder related pain. If you're not sure what we're talking about, then please go and check out the first video, which will be linked here. It's going to be in a playlist, so it should be easy to follow along. But yes, so today we're going to go over the literature and figure out what the treatment recommends. And on this channel, what we love to do is we love to look at systematic reviews, and I've spoken about that before. But basically, they are the best thing that we have in terms of making recommendations for the general population. What they do is they take all the best trials on any given issue, which could be a drug or whatever, but in this case, it's non-specific shoulder-related pain. So it takes all the best studies that have been done individually on that, brings all of that together, all the participants, all the exercises, all the treatments that they did, and analyzes them as a whole so that you can then have a bigger amount of people, and then any results that you find become much more significant to the greater population. Simply put, if you have one study and it only has 30 participants, but then you take 10 studies with 30 participants, it's easier to then make recommendations for the rest of the world and the wider population based on that. So yes, the literature on this is very clear. Similar to what we spoke about in the first video, is that surgery is not recommended. Like we spoke about in the first video, there is no correlation between the distance that your acromion and your humeral head has. The space between them has no correlation with your symptoms. Doesn't matter if it's small. Doing the decompression surgery is not going to help. So that is the most important thing from the literature, is this is not recommended. So if you're a patient and someone is suggesting there's surgery to you, ask them why. Because you've seen this video, you've seen the studies, I'm showing you them right now, the references are there. Why are they asking you? Because it can still be helpful in some cases. They just might not be telling you exactly what they want to do to your shoulder. But if they say they want to do a decompression surgery, they want to increase the space between your acromion and your humeral head, they say that they're going to increase that space, that is a red flag, because we know that this does not work and you should say something to them. And if you're a therapist or an orthopedic surgeon and you're watching this video and you still recommend that surgery, ask yourself why. We have all this evidence that suggests otherwise. The next thing that the literature recommends is strength and conditioning. It comes up a lot, but strength and conditioning seems to be one of the best ways to help alleviate the symptoms. Now, unfortunately, the evidence isn't very strong. We don't see dramatic increases or improvements in pain, but we do see gradual improvements over time. Typically, these studies are anywhere from 6 to 12 weeks, and then even 6 months and a year later, they check back in with people. And we do see that pain does come down, and we do see that function does increase. Now, pain is not eliminated after about 6 months to a year in all cases, but it does get better, and most people have a more normal function. They still maybe just feel it some mornings when they do a little too much, or when they really extend themselves, or in isolated areas, rather than at the beginning of the pain when they felt it almost all the time. So we do see an improvement, and it will get better over time, but it does require a lot of patience and gradual development. Now, these strength and conditioning programs will focus on that. They focus on building the strength of the rotator cuff. And in your rotator cuff, you have 4 muscles. You have your supraspinatus, your infraspinatus, your subscapularis, and your teres minor. And they're basically sitting on the back of your shoulder blade. And then they're coming in to attach onto your humeral head in different areas, in and around your glenohumeral joint. And they also interact with the long head of your big bicep muscle and your arm as well. And then on top of that, you've got your subacromial bursa. We've spoken about all of these areas before, but it's good to go over them. So this is what we're targeting. We're targeting this region so that we can make sure that it is mobile, that it is strong, and that it can withstand the trials and tribulations of life. So as we've spoken about before, this injury is common in people who have a lot of shoulder requirements for their life and for their job. They have quite a manual and job that requires a lot of that. So then they always ask me, why am I doing shoulder exercises when I'm moving my shoulder all the time? And also you're telling me that it's probably the moving my shoulder so much that's causing the pain. And it is a very, very good question. And I understand how it almost does seem counterintuitive. The reason is that we need to develop it. And perhaps what's happening is the work that you're doing, you're not really working on developing your shoulder muscles or whatever, and it's more just getting fatigued and tired. And over time, it is developing, but we want to accelerate that development. There's a reason that bodybuilders do so much exercise. They really want to increase the development of their muscles as much as they can. They want their muscles to get stronger before they have to lift the big heavy weights, essentially. You know, if you're wanting to lift higher weights, you're constantly preparing your body. And as you get older as well, you have to consider that your body naturally can start to just lose a bit of muscle mass, lose a bit of strength, lose a bit of balance, lose a bit of coordination. And if you're not actively working on it, then you're going to increase your chances of getting more injuries and pain. The other thing to consider as well is that it's just a good, effective treatment. It doesn't really cost anything, and you can get started simply. You can do a lot of it at home, and it gives you control as the patient because you're going to take responsibility for it. And these things are all very, very important. Other types of exercises that can be quite helpful is just simple stretches and things like that. You'll find there are always certain stretches that help make people feel better, especially when the pain increases a lot. And we do see some emphasis on trying to do eccentric exercises, which is basically like controlling the opposite movement. So if we say one of the key movements of the shoulder is that it will bring your arm in towards your chest. We call this internal rotation. Now, the eccentric part of that movement is as my arm comes out this way. So basically what it's saying is you start to focus on the moving back out the way. And this can help reduce the symptoms. Now, there's not a lot of strong evidence there, so just general strength and conditioning is still better, but it's always good to have these like specialized tests to see. The other thing that we see that can help is some manual therapies and some joint mobilizations and some massages in and around areas, particularly when pain flares up. Having someone put their hands in and do something can help reduce the pain. Why? Well, because this type of injury is really overwhelming, and most of the time you feel like the whole world's against you. So when a therapist sits down with you, puts you on the table, gives you that time and attention and some care, it really, really helps you and it makes you feel a lot better. Now, a lot of manual therapists out there will tell me that no, it's got nothing to do with that. It's because of the actual movements that we're performing, particularly if we're doing joint mobilizations and they're rubbing along here and moving it up and down. No, we know that with manual therapy, the reason that it can be so potent and powerful is because of that human to human connection. As the patient, we feel comforted, we feel safe, if that's how it makes you feel. If that's not how it makes you feel, you'll find that it can be ineffective. But what I would say to you guys is that we'll talk about it in the next video, is that if you appreciate that type of treatment, whether it's massage or anything like that, you can ask someone around you, a partner or anyone you have at home, to do anything for you, or you can rub it around your shoulder yourself. And the key thing is that you don't even have to do it in the area that's affected to feel the benefits of it, because it will circulate through your whole body. So you could do the other shoulder, you know, if someone could do that for you and get in really deep and do a nice massage. And again, the technique is not important here. You just rub it away. You're gonna make it feel better as long as you don't push into too much pain. And this is where the professionals are good, because they're better at knowing when to push and when to stop. But if you're getting someone to do it for you, just get them to do it on the opposite side or in different parts of your body, but still make you feel relaxed, because that's the key here. You typically can feel relaxed and soothed by this type of situation. And those are really, really the key things, and just general day-to-day management of your symptoms. So being aware, being smart with it, knowing what can trigger it, knowing what can help it, and taking some key responsibilities for it there, taking some paracetamol and some painkillers when you need to, using any heat and ice therapy when you need to, whatever you can do to help mediate it. But just knowing that over time, the trend that we see is that the pain does start to reduce, especially if you involve some strength and conditioning training and some sort of holistic treatment approaches. So that's the main thing, is that this injury can get better. It's an odd one and it's a long journey and it requires a lot of patience, but it can improve. And I think the best part about it is that you as the patient can take control of how we improve that. So yes, that is a summary of the literature. As always, they've got the references and everything down below if you want to have a look at some of the papers that I have been talking about. And in the next video, I'm going to share with you my exercise program that I have developed for rehabbing non-specific shoulder-related pain.